if you knew that the pay was so bad, why did you decide to go into that line of work?
Yeah, so we hear that quite often, actually, and it's not something that's happened overnight. This has been a gradual build-up and a gradual.
But that's why. Sorry, just Dr. Vivek. That's why I'm a bit confused. Is because you said it's been going on for 26 years or whatever. It's been eroded. You look quite young. You're junior doctor, yeah. So I just don't understand why, knowing all of that, why you would try to go into something if you knew that the pay was so awful.
So the pay's got worse as things have got on, and we see how that manifests. We see the poor standards of care that leads to. Anyone who's been working in the NHS, even for more than 1 year, who's been able to see a change in has been able to see a change in the way that morale is within staff, and how that leads to poorer standards of care. So the waiting list that patients have to wait on for elective procedures or appointments now exceeds 7 million. That's 7 million people in the UK who might not be able to work, who might not be able to walk around, who might not be able to live life to their fullest ability because we're not able to do the care that we need to. And ultimately, that's because we've got a huge workforce crisis. So it's estimated that there's between 8,000 and 9,000 doctor vacancies in the hospital. And the GMC, which is the regulatory body that overlooks doctors, expects there to be 16,000 more vacancies by 2030. So we need to do something to stop this from happening.
And the crisis of patient care, in your view, goes away if we start paying doctors more. What are you on at the minute?
So I'm a doctor I've been working for 7 years. I'm on £24 an hour. I'm an anaesthetic doctor where I work in anaesthetics and intensive care. So I look after critically unwell patients when they come through the door, having to put tubes into their mouth to help them breathe for them, and help, look after them whilst they're on organ support. This is, it's grueling. These are the people that are the sickest of the sickest in the hospital. And it's just not commensurate with the level of workload that we undergo.
And what do you want to be paid then?
So all we're asking for is our pay cut that we've had over the last 15 years to be reversed. And what that looks like is a new doctor who's starting with £100,000 a day after they've gone to university for 5 to 6 years, who's on £14 an hour. We want them to be paid £19 an hour. And at the very senior end, doctors who've been working for 10 years or so, who are currently paid £28 an hour, we want them to be paid £38 an hour. Now, that's not a tall ask for the government. That will cost them roughly £1 billion, and we know they've spent far more than that for unusable, faulty
I get
PPE. They were just considering.
Yeah. I understand that. I just got to put this to you, though, because you keep talking about a pay cut and things. And the NHS as a whole has had a real terms 39% funding uplift, real terms, since 2010. Is it all very well and good directing anger and strikes at the government, which affects patient health, but maybe, just maybe, you'd be better looking within the NHS at some of your management and saying, where are you spending all of this money? Could we be less wasteful? And actually, could you actually manage the NHS better? Or are you not willing to do that? You're just going to plough ahead and say, we just need a pay rise, and that'll sort everything out.
So there's a couple of things going on. I'm not sure where that number's come from. I'd love to see it myself. But, when we ask doctors why they're unhappy and why they're wanting to leave the NHS, the number one reason is pay. The BMA undertook a survey just before Christmas, in which, alarmingly but not actually surprisingly, there was 40% of respondents were ready to leave the NHS and were going to do so when they found a new job. More than two-thirds were actively thinking about leaving the NHS. If you stay in your current role and you work your way up, right? This is the argument against it, isn't it? Which is all very well and good saying that you do an incredibly difficult job, and you do. There's no doubt about that. Absolutely not. But if you stick around doing what you're doing now, you can end up on very good money with, let's be honest with you, Vivek, a cracking pension, a pension that a lot of people in the private sector would kill for. OK, and so is that not part and parcel of professional life, starting on a very low down salary or a lowish salary and having to put a lot of hard graft in and then working your way up to being on a good salary? Is that not what you're just doing? Well, there's a couple of things about that. One is that actually the NHS pension isn't what it used to be. I appreciate it's helpful, but it's not what it used to be. But the main thing actually is it's not a free ride to become a consultant or a GP. It takes a lot of work, and you have to pass specific competencies, exams, which we have to fund ourselves. And not everyone gets there. People don't always progress, and some people burn out and drop out. So the prospect of something in the sacrificing something now for the prospect of something in the future isn't a strong argument.